Welcome back to MedicareJourney.org. We are on topic number 9 of the top 10 critical and costly Medicare mistakes to avoid. Number 9 is misunderstanding the difference between a Medicare supplement plan versus a Medicare Advantage plan. I wished I had a penny or maybe a nickel for every time a client called us. We spoke to a Medicare beneficiary. We asked them, which plan are you on? Which plan do you have? Oh, I'm on a supplement plan. Well, how much are you paying for your supplement plan? Zero. I'm not paying any. I'm paying the Part B premium. Well, my friends, you are not on a supplement plan. You are on a Medicare Advantage plan. It's important that you know the difference. You've got to be educated. You have got to know what you have, where you're at, where you're going, who your Medicare professional agent or advisor is, and make sure that you don't just set it and forget it. Especially if you're on a Medicare Advantage plan. I can say that if you're on a Medicare supplement plan, that you can set it and forget it, depending on the carrier that you go with. And we're going to talk about that in just a second, because there are many carriers to choose from. So let's first focus on Medicare supplement. Medicare supplement is the opportunity for you to have when you have your original Medicare A and B in hand. Your Medicare A is your hospital, B is your doctor. It's going to have an effective date. So once we have that effective date, now we can enroll you in a Medicare supplement plan. And again, on Medicare supplement, it's a little bit different. The rules are different with supplement versus Medicare Advantage. You have a 6-month open enrollment period from the time you turn 65. So when you turn 65, you have 6 months to enroll into a supplement plan. Not sure why you'd want to wait, but there may be a reason why to wait, and some people do. And there are 9 different types of Medicare supplement plans. The chart on your screen will show you those 9 different plans that's available in the United States today. Now, I've never, in my 15 years of experience, never have enrolled anybody in a Plan A or a Plan B. It just makes absolutely no financial sense to do that. And there's just way too many gaps in the original Medicare. Plan C and Plan F are no longer available for those that are turning 65 after January 1, 2020. So you got Plan D, you got Plan G, you got the high deductible Plan G that you don't see on the chart, but it's there. Also, you have Plan K, L, M, and Plan N. Now, Plan G and Plan N are probably the 2 most popular plans today. If you take a look at the chart, you can see that all the green check marks are in the columns with Plan G except the Part B deductible. So that means that the only out expense that you are going to have on your Plan G Medicare supplement is the Part B deductible of $233 for 2022. That means if you go to the doctor, you go to the hospital Part A deductible is $1,556, which you can have every 60 days in your benefit period. So that Plan G is going to pick up 100% of everything that original Medicare does not pick up. Again, except the Part B deductible each year of only $233. Plan N, a little bit different than Plan G. The Plan N, you also have the Part B deductible each year of $233, and you'll have up to a $20 copay when you go to the doctor. And the premiums are typically maybe $70 to $100 less a month on Plan N versus taking Plan G. The one mitigating factor that you have to recognize with Plan N is that it does not, if you take a look at the Plan N chart, it does not cover the excess doctor charges. Now, again, we spoke about that in one of our previous segments. The excess doctor charges, those are the charges that a doctor who does not accept Medicare assignment, they accept Medicare, but they do not accept assignment, and they could potentially charge you 15% over and above what Medicare allows. So if you're on the operating table and that anesthesiologist just bought a pair of his and hers Mercedes-Benz, and they don't take assignment, guess what? You might be paying a portion of their Mercedes-Benz if you have Plan N. But listen, 96% of doctors that accept Medicare in the country today do accept Medicare assignment. So it's very rare that you're going to have that problem. The one thing that if you take Plan N, and for those of you that have Plan N, if your agent hasn't told you this, one of my best recommendations is when you go to have a procedure done by a doctor, you want to make sure that that doctor who's in the operating room, who's going to be operating on you, the anesthesiologist, and anybody else, any other doctor who's going to be in that surgery center, accepts Medicare assignment, so you don't have any surprises. And then there's one more plan on that chart that's not shown, but it's called the High Deductible Plan G, or HDG. We are going to do a segment, maybe a 2-minute, 3-minute segment at the most, on the HDG plan, because so many people don't know about it. I think it's one of the best kept secrets in Medicare today. And most agents don't like to talk about it or present it because it's so inexpensive and there's so little commissions made on those types of plans. But I'm going to bring that information to you today so you know that you have an opportunity to enroll in the HDG plan. And it's very simple once you understand how the plan works. Now let's talk about some of the carriers when it comes to Medicare supplement plans. As I mentioned before, premiums can vary up to $100. I mean, Plan G is Plan G no matter how many ways you slice it. The same benefits with Carrier A is going to be the same benefits and offer the same benefits as Carrier Z. What may vary is not only the premium, but also the length of tenure that they've been in the Medicare space. What also may vary is the financial stability of the company. What also may vary is the rate stability of the company. Because you got to be careful when you're selecting a Medicare supplement plan, you don't base it on who has the cheapest premium. You just don't do it. A lot of carriers may come in and buy a block of business at a reduced premium and then raise the prices when those claims start coming in. So be very prudent and ask questions about the carrier. Don't be afraid to ask questions about the financial stability, the claims paying ability, the rate stability of the carrier. These are important, more important, or just as important as questions about premium. So don't ever get fixated on the first year premium, because Carrier A may have a premium of $150 for that Medicare plan. Year 1 when you turn 65. Year 66, they may go up 5%, maybe. Year 7, 67, maybe another 2%, maybe 68, they may go up maybe 10%. Maybe by the time you hit the 70, they now may be in double-digit increases. So very important that you select the right Medicare supplement plan, the right Medicare supplement carrier, and the right Medicare supplement agent, who is a professional agent, who is independent and unbiased. Very important. Now let's talk about Medicare Advantage plans. Medicare Advantage is also known as Part C. When you enroll in Medicare Advantage, you are opting out of original Medicare. You're no longer in Medicare A and B, and now your Medicare Advantage plan, your ID card that you get from that plan sponsor or from that carrier, is now what you are going to use for your care. And any claims are not paid by Medicare, but they are paid by the Medicare Advantage carrier. You do have networks with Medicare Advantage. And I will tell you that doctors who may be in the network today may be gone tomorrow. It just happens. So you've got to be cognizant of that fact. You've got to be able to have some flexibility if you're going to enroll in a Medicare Advantage plan, because you may have, you may want a primary care doctor, and you may have a cardiologist and a pulmonologist. And maybe those doctors or two of those doctors may not be in the plan. So you got to find the right plan with the right Medicare Advantage carrier. And also what comes into play, not only the network, but also the formulary. Let's say that all your doctors are on that one Medicare Advantage plan that your neighbor said, you gotta have it. They're the best. You gotta take this plan. And you go to enroll in that plan. Yes, your doctors may be in it, but now what you didn't take into consideration was the formulary. You might be on 5, 6, 7 different types of drugs, and the formulary might be tiered as tier 2 or tier 3 drugs, maybe tier 4 drugs. Whereas another Medicare Advantage plan may have 2 of your 3 or 4 doctors in that plan, but yet all of your drug formulary could be tiered as tier 1 and tier 2 generics. So there are very important things that you've got to consider, and you've got to get it right. And by working with an independent professional agency or an agent that specializes in Medicare, they'll be the ones to help and guide you down the right path for you to make the right choice. Again, whether it's Medicare Supplement or whether it's Medicare Advantage, you've got to choose one of the two. If you're staying on original Medicare alone, again, it's going to be important and imperative for you to understand that you're going to have major out-of-pocket expenses with original Medicare alone. If you have questions or concerns, pick up the phone and call the professionals at MedicareJourney.org at 833-267-6700, and we'll get you the help that you need. If you're looking for an agent, an independent, unbiased agent, in the state that you're in or the area that you're in, we'll help find one for you. Thanks for watching.